Okay, we're now bringing you breaking news. We've got coming in, as you can see. So you might remember a little bit of context before we go over to this study. It was in the Lok Sabha, in Parliament, that the Health Ministry was asked about studies that it said were being carried out about the sudden cause of deaths, a surge of deaths you saw in younger people post-COVID over the last, as we've told you, over the last stretch of time, over the last few years. Now, there are 3 studies, according to the Health Ministry, that were being conducted. The Icmr was researching, in particular, the causes of these deaths. Now, the Icmr has said that there are 2 causes in particular. Not the COVID vaccination, they're saying, but COVID itself and younger people who were exercising even though they'd been warned not to. That's what Icmr is saying is the causes of this. So essentially, they're saying intense physical activity after severe COVID, but also severe COVID itself. These are the 2 reasons for sudden deaths in younger adults. Now, my colleague Shireen is with us to bring us more details. Shireen, can you tell our audiences the Icmr study, who exactly was conducting it within the Icmr? I asked because there were many questions around the bias or the possible lack of bias in a study like this when the vaccinations were also developed by India. But can you just tell our audiences what there is to that measure, to that point?
Well, this is a multi-centric match case control study that was conducted over with the help of about over 20 scientists. This is something that is part of their study, because remember, there are simultaneously a number of studies that are going on, whether the vaccination is connected to the heart attacks that are seen, and another is whether the vaccination is related to the sudden death that we are seeing in youngsters. Now, based on that, there was this study that was conducted through the participation of about 47 hospitals across the country, and there were individuals who were observed with the age of 18 to 45 years without any comorbidity, who have been suddenly hospitalized or have any sort of unexplained disease or symptoms as far as the sudden death is concerned. Now, this entire study is something that was conducted during 1st October 2021 to March 2023. So all the sudden deaths and the people who have complained due to vaccine, if they have found any sort of symptoms in them, these were between 2021 to 2023 till March. They were observed, and what are the reasons for their sudden death is something that was analyzed. And the conclusion of the study has been that the COVID-19 vaccination did not increase the risk of the unexplained sudden death. In fact, they have been saying that family history of sudden death and certain lifestyle behavior is the reason why there is a likelihood of unexplained sudden deaths that are being seen in people. And the vaccination, at the moment, there are no studies to show that the vaccination is related to the sudden death. Of course, this is one of the studies. There is another study which is very much awaited, that is about whether the vaccination is related to the heart attacks that we are seeing in the country. That is yet to be released. This, of course, is a part of the study which says that the sudden unexplained deaths are not related to the vaccination.
Okay. Can you just tell our audiences, please, Shireen, what are the different studies? Because this is one study. There's a second, as you've just told us, that was looking at specifically heart attacks. But because there was a lot of disinformation about the possible causes of a rise in cases of sudden cardiac arrest were circulating in particular, is it just these 2 studies? Are there 3rd and 4th studies that are also looking at this case?
There are multiple studies that are going on. One of the, of course, interesting studies is that whether there is a need for booster dose now that the COVID cases have gone down, whether there is a 4th shot that should be inoculated to the population. That study is, of course, going on simultaneously. Apart from that, like I mentioned, the cardiac arrest, the sudden heart attack, another study which is going on. All those results are, of course, awaited. But in the process, this is one of the first studies that were done where vaccinations related to the unexplained sudden death. Because if you remember, there were a number of people who have raised questions that could the vaccination, inoculated vaccination, could actually further the infection in individuals, and can it actually further, point to unexplained death. So that is, of course, has been cleared in this study, where they have made it very clear that the vaccination is in no way related to any sort of sudden or unexplained death in the population.
Okay. Shireen, thank you for bringing us those details. This is a story we continue to track right here on the show. For now, it's time short break. On the other side in just a few minutes, more of the country's top stories. This is the Breaking News Show on CNN News 18.